Hello and welcome. I am Dr. Ankit Parakh and I work as a consultant in Pediatric Pulmonology, Allergy and Sleep Medicine at Children's Chest Clinic, New Delhi. So in this video, we'll talk about comorbid conditions associated with asthma, or what are the common illnesses which we see in children and adults who have asthma. Now, as we know, asthma is a very common chronic respiratory disorder which is seen world over in children and adults. And many of these children and adults also have accompanying problems which leads to worsening of the quality of life. The common problems seen associated with asthma are nasal allergy, also known as allergic rhinitis, eye allergy or allergic conjunctivitis, obesity and obstructive sleep apnea. So in this video, we'll try and talk about these conditions, and we'll also talk about that why treatment of these conditions is important. Now, nasal allergy, also known as allergic rhinitis, is extremely common world over. It is thought that almost 40% of people all over the world have allergic rhinitis. In children and adults who have asthma, the incidence can be as high as 80%. So 80% of children with asthma have associated allergic rhinitis. Now, allergic rhinitis leads to nasal symptoms like itching, running nose, blocked nose, and sneezing. A lot of children also have a postnasal drip where the mucus goes down the throat and leads to a lot of cough. These children have a lot of cough at night and sometimes can be associated with vomiting. Treatment of allergic rhinitis is extremely important to have a good control on child's asthma and improve the quality of life. It can have a lot of impact on the child's schooling, on the child's sleep, on the child's leisure, and so on. The second problem which we see commonly associated in children with asthma is allergic conjunctivitis or eye allergy. Now, children with eye allergy can have red, itchy eyes, they can be watering, and it can be very troublesome for the child. Now, some children with allergic conjunctivitis can have a more complicated form known as vernal keratoconjunctivitis or a spring catarrh. Now, in this situation, the outer layer or the white part of the eye, also known as the cornea, gets abraded. And it is extremely important to pick up this condition as it can lead to problems with vision later. So, treatment of allergic conjunctivitis is also extremely important in children. The third common problem which we see associated with asthma is increased weight and obesity. Now, it is seen that children with asthma can get obese independently, and obese children have a higher risk of getting asthmatic. It is also seen that children who are obese or overweight, and if they have asthma, they need more medicines to get a better control. They have more asthma flare or asthma attacks. They have higher chances of having hospital admission. Treatment of obesity hence becomes important to achieve a better control of child's asthma. Now, sleep apnea is a common problem world over, and it has been seen that children with allergies are more prone to develop sleep apnea. Now, obstructive sleep apnea or sleep apnea is considered now to be an inflammatory state, and the body releases a lot of cytokines which can worsen the child's asthma. And asthma can independently worsen the sleep apnea of a child. So children and adults who have asthma, they have double the risk of developing sleep apnea. It is hence important to screen all patients with allergies and asthma for associated sleep-related problems and sleep apnea. So if your child is having asthma or asthma-like symptoms, do get in touch with a pediatric pulmonologist for proper evaluation of the asthma and the associated comorbid conditions, and the treatment will lead to a better outcome.